Hello everyone, this is Ghassan Lockby, a rhinologist at King Faisal Specialist Hospital in Riyadh, Saudi Arabia. We're going to talk an interesting case about a young gentleman who had an air pellet stuck in his right frontal sinus. This is the CT scan and we can see the air pellet stuck there, and moreover he had CSF leak because of a skull base fracture at the posterior table. So we decided to go and retrieve this pellet. We started by identifying the left frontal sinus and decided to go from left to right, doing a sinus drill out to be able to identify the pellet and remove it without incidental intracranial injury or pushing the pellet into the frontal sinus by going through the same side. So here we're doing the drill out and moving from the left towards the right frontal sinus. Further drilling is done, and here we went to the right frontal sinus and looking for any glimpse of this pellet, but nothing so far. More and more patient drilling is being done. Here we see the first signs of the pellet, and we can see that it's partially stuck at the right frontal sinus. However, we have more drilling to be done to be able to retrieve it safely. There it is, and we finally can see it. And if you know, there is a skull base defect just to the right side of the pellet. And now we use a giraffe forceps trying to gently pull it out without doing any further damage. And here the pellet was successfully removed. And now for damage control. We're looking at the skull base defect at the posterior table of the frontal sinus, and as you can see here, and because it's a small defect, we decided to fix it through a single layer of free mucosal graft that was laid over the defect, as we can see, and then the center was tucked intracranially and supported by gel foam and Surgicel. The patient has been followed for more than a year right now, with no complication or further CSF leak, and with patent frontal sinus. Thank you very much.